Hello everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss important MCQs. Who all have visited first time on this channel, please do subscribe and watch. Let's see the first question. A patient exhibits rapid onset of facial swelling, hypotension and respiratory distress minutes after receiving IV antibiotics. What best describes this reaction? Right option is A, that is anaphylaxis, that is type 1 hypersensitivity. Next question, which signs and symptoms are most characteristic of acute adrenal insufficiency? Right option is B, that is hypotension, hyperkalemia, hyponatremia and abdominal pain. Next question, a patient with systematic lupus erythematosus reports malar rash, arthralgias, hyposensitivity and proteinuria. Which pathophysiologic mechanism underlies these manifestations? That is right option is D, that is immune complex deposition with complement activation and tissue inflammation. Next question, a patient with hypothyroidism is started on levothyroxine. Which signs would indicate overtreatment? Right option is B, that is palpitation, heart intolerance, weight loss and tremor. Next question, which clinical features best indicate hypovolemic shock from acute hemorrhage? Right option is A, that is tachycardia, hypotension, full clammy skin, decreased central venous pressure. Next question, a patient with chronic liver disease presents with asterixis, confusion and elevated ammonia levels. Which immediate nursing intervention is appropriate to lower ammonia levels? Right option is A, that is administer lactulose to promote ammonia excretion by stool. Next question, a patient history of peptic ulcer disease presents with sudden severe abdominal pain, rigid abdomen and free air under the diaphragm on chest X-ray. What is the likely diagnosis? Right option is B, that is perforated peptic ulcer leading to chemical peritonitis. Next question, a surgical patient develops sudden oliguria, rising creatinine, muddy brown granular casts on urinalysis following hypotension during surgery. Which diagnosis is most likely? Tubular necrosis. Next question, a patient complains of redness, warmth, swelling and limited motion in a single joint with fever following bacteremia. What is most likely? That is septic arthritis. Next question, a patient with hypokalemia presents with muscle weakness and ECG changes, peaked T waves and widening QRS complexes. What is the immediate priority intervention? Right option is A, that is administer IV insulin with dextrose to shift potassium intracellularly. Next question, a client 12 weeks pregnant comes to the emergency department with abdominal cramping and moderate vaginal bleeding. Speculum exam shows 2 to 3 cm cervical dilation. What is the nurse documentation? That is immediate abortion. Next question, which is not a predisposing factor for hyperemesis gravidarum? Right option is D, that is malnutrition. Next question, at 36 weeks gestation, where is the uterus fundus typically located? Right option is B, that is xiphoid process, that is lower sternum. Next question, When the nurse checks the fundus of a client on the first postpartum day, she notes that the fundus is firm at the level of the umbilicus and is displaced to the right. The next action the nurse should take is to. Options are here. Right option is A, that is check the client for bladder distension. Next question. The client has an order for Demerol and Phenergan to be given together. The nurse is aware that the purpose of this order is. Right option is A, that is for its synergistic effect. Next question. The physician has ordered an injection of ichogam for a client with blood type A negative. The nurse understands the ichogam is given to. Right option is B, prevent the formation of Rh antibodies. Next question. A client with Alzheimer's disease is awaiting placement in a skilled nursing facility. Which long-term plans would be most therapeutic for this client? Right option is C, that is placing simple signs to indicate the location of the bedroom, bathroom and so on. Next question. Which sign suggests neuroleptic malignant syndrome rather than serotonin syndrome? Right option is B, that is lead pipe rigidity and very high CK. Which of the following baseline laboratory data should be established before a client is started on tissue plasminogen activator or right option is C, that is hemoglobin level, hematocrit and platelet count. Next question. A client with hypochondrias repeatedly seeks reassurance despite negative tests. Best nursing approach. Option is B, scheduled regular brief visits focusing on coping and function. Next question. The nurse is developing an education plan for clients with hypertension. Which of the following long-term goals is most appropriate for the nurse to emphasize? Options are given. Right option is C, that is commit to lifelong therapy. Next question. What is the color coding of a bag in hospitals to dispose of waste straps? Option D is the correct answer, that is blue. Next question. Which of the following categories of biomedical waste in India do not require containers or bags for disposal? Right option is D, category A, that is liquid waste. Next question. A known HIV positive patient is admitted in an isolation ward after an abdominal surgery following an accident. The resident doctor who changed his dressing the next day found it to be soaked in blood. Which of the following would be right method of choice of discarding the dressing? Options are given. Option A is the right. Here, pour 1% hypochlorite on the dressing material and send it for incineration in an appropriate bag. Next question. Which of the following in an international agency which assets in program that benefit child health most? Options are here. Right option is C, that is UNICEF, United Nations International Children's Emergency Fund. Next question. One basic health worker was recommended by. Options are given. Chada committee. Next question. All are true about Anganwadi workers except. That option is B, that is covers population of 5,000. Next question. Midday meal program. The meal served should supply at least of the total energy requirement. Right option is A, that is 1/3. Next question, the disease that comes under National Vector-Borne Disease Control Program are except. Right option is D, that is swine flu. Next question, National Malaria Eradication Program was launched in the year. These are the options. Right option is B, that is 1958. Next question, management of area with annual parasite index less than 2 include except. Right option is A, that is regular insecticidal spray. Next question, case finding in RNTCP is based on. Right option is B, there is sputum microscopy. Next question, an employer contributes percentage of water of wages for the benefit of employee in every wage period under EG Act is. Option is A, that is 1.75%. Next question, International Labour Organization is situated in. Right option is A, that is Geneva. Next question, ESI Act 1948 was last amended in the year. Options are given. Right option is D, that is 2010. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.